350 kilometers above the Earth is the International Space Station, a marvel of human engineering and scientific research. The space station has a robotic arm used by astronauts to perform tasks that need absolute precision and dexterity. Technology similar to the space station robotic arm is now available here in the country and is being used in surgeries. I'm Dr. Freddy Gomez. Let's take a look at this emerging, state-of-the-art type of surgery. Surgeries can be terrifying and worrisome for patients. But these days, there are options to instead undergo a minimally invasive procedure, which also means recovery period is much shorter. We are joined today by Dr. Jennifer Jose. She's the head of the Robotics, Gynecology, and Urogynecology Pelvic Reconstructive Surgery of the Department of Obstetrics and Gynecology at the St. Luke's Medical Center at Global City. Welcome to the program.
Thank you. Thank you.
Now, a lot of people mention or hear about robotic surgery, but aren't quite really sure what this exactly is. Could you explain to us what robotic surgery is?
Okay. Robotic surgery now is the most advanced cutting-edge technology in minimally invasive surgery.
Right.
Okay. Now, the robot is only a surgical tool or armamentarium to help surgeon perform minimally invasive surgery. So we have the robot, but just to make sure people know about this, it's still the surgeon who does the surgery.
Has this technology been around fairly new, or has this been around for quite some time?
Well, here in St. Luke's, we started around 2010.
What are some of the advantages that one can benefit from?
You know, there's so many selling points of robotic surgery than open surgery. Number one, there is less pain, less infection, less chances of complications, okay? The patients recover very fast. And I think what is very good is that you as a surgeon can actually do complex procedures in a very minimally invasive manner.
Can just any surgeon who is adept, like yourself, a urogynecologist, can they just jump on this machine right away and be able to operate it adequately?
Actually, in my opinion, for gynecologic surgery, I think it is really good if you are a laparoscopic surgeon first, because there are different kinds of procedures that you can do, like hysterectomies, adhesiolysis, endometriosis, removal of fibroids, suspensions, and all this, which are actually very difficult too. There is a learning curve for this. So, you know, when you do robotic surgery, it's not only doing laparoscopy, but we also have to be trained with the machine, which is actually a separate training from the surgery itself.
Now, you're recognized as one of the forefront robotic surgeons here in Asia, or even in the world. Does this type of a training benefit more surgeons in the long run?
It will definitely benefit surgeons a lot, because first, imagine if you can do a minimally invasive surgery like you're doing open, that you don't compromise the patient. I think that is number one, that is really good. Number two, you know, it's not only the patient who benefits from this, like all what I have mentioned to you, but actually the surgeon. Remember, when you do robotic surgery, you're actually seated. So your body is not contorted to the body of the patient lying down. So there will be less stress on you too. And just to let you know that when you do surgery, if your fingers are moving, like for instance, you have Parkinson's disease, it doesn't transmit to the patient. So it's like saying that your procedure is very accurate when you do the surgery.
Right. So even doing surgeries, there are, despite the surgeon having steady hands, there is still a little bit of that fine tremor. So this machine will be able to cancel all of those out.
Not only that, because the machine is three-dimensional, it's like the surgeon inside the body of the patient, and you're just beside the blood vessels and the nerves. So the chances of the complications is actually very minimal, right? Because you're just beside it. You can see it very clearly.
Right. Now, being a urogynecologist, how were you able to integrate this type of technology with your practice?
Okay, in urogynecology, I deal with a lot of prolapses, incontinence. I do a lot of suspensions. When I do minimally invasive surgery, it's very difficult to operate in the pelvis, right? But with this technology, I'm able to reach the deeper portions Like, for instance, when I do incontinence procedures, like bridge procedures,
Right.
sacrocolpopexis, and also some prolapse surgeries that you need to suspend. So this is actually very, very good.
Now, going back to the qualifications in order for someone to be adept at robotic surgery, could you tell us a little bit more about your journey into this? Were you a techie person to begin with?
No, actually, I'm not a techie person. I'm not even very good with my cell phone, and my nurses know about this, right? But then it's a difficult training in the sense that you really have to concentrate. You have to be very good with your craft in terms of surgery and laparoscopy. And then it's a different training, like what I mentioned, when you do the machine.
Right.
We actually were brought by St. Luke's in the US, okay, to train with the pig. You have to be master of the machine because, of course, we have to think about the safety of the patient all the time.
Always.
So it's not easy to just do one procedure or one exposure and then you're going to be good with surgery. You need to do a lot of training, exposure, and you have to do certain number of cases for you to be accredited as a robotic surgeon internationally. What we do right now is that the robotics company, the Transmedic, has given me this task to be a proctor in Asia for a procedure, sacrocolpopexy,
Right.
which I teach in different countries right now. Like I teach urologists and urogynecologists in Asia, like in Malaysia, Vietnam, Korea, and also in Singapore. I've done several lectures on that. And at the same time, you know, we're part of the Asian Gynecologic Robotic Surgery Society, so we promote teaching and advancing the knowledge to doctors and also the different applications to patients. The two board members are actually here in Gyne.
When we return, we will take a closer look at how robotic surgery is used in reproductive health concerns of women. This is MedTalk Health Talk, only here on CNN Philippines. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk on CNN Philippines. A woman's reproductive system is one of the most delicate systems in the body, and there will be instances when women will need surgical procedures. Robotic surgery can be an option. Joining us is Dr. Jennifer Jose, the head of the Robotics, Gynecology, and Urogynecology Pelvic Reconstructive Surgery at the St. Luke's Medical Center, Global City. So, what are some of the symptoms that a woman might feel where she might feel alarmed or she might feel that something is off that might need robotic surgery in the future?
Well, normally in gynecologic conditions, usually these are the complaints of the patient. They have abnormal bleeding, especially when you are in the perimenopausal to menopausal age group. Definitely you need to do a biopsy because some of this bleeding can lead to malignancy, right? And if that's the case, then you know a hysterectomy might be needed for that particular patient. Another thing can be like presence of myomas or fibroids that causes pressure symptoms, or for those who still wants to have children and this can cause any obstruction, then this can actually be removed. Now, what I think is very good here is that when you reconstruct with the use of the robotic arms, you know, you're doing it like an open surgery. You're putting it back together like in its normal state. You don't compromise the stitching of the uterus in a very minimally invasive manner. Then we can also have like ovarian cysts that do not respond to medications or they turn out to be leading to possible malignancy, then you can actually take them out like this. Or if you have, let's say, prolapse or BUA, right? So for the elderly and incontinence, you can definitely do this kind of surgery.
Now, when a woman comes in for initial consult, when she feels something is off, something is wrong with the system, she's given a full, comprehensive examination first and offered several options, actually.
Right. Actually, the indications for open surgery is the same for laparoscopy and also robotic gynecologic surgery.
So here we are in the main operating room of St. Luke's Global City, and this is where the robotic system is stationed.
Right.
So what are some of the things that you like about this machine, Doctora?
Okay, well, number one is three-dimensional. So you see things very well, okay? Remember, it's not only the patient that benefits from this, but also the doctor. Look, after we dock the robot to the patient,
Right.
you sit down, right? And you have finger works and also footwork. So, you know, your body doesn't get tired too.
Okay.
And what's very good about it is that, let's say your fingers have tremors, it doesn't transmit to the patient.
Okay.
That's why it's very stable. So, you know, we have accuracy and precision.
Now, some of the fears that people might think is like something might go wrong while the robot is inside them. This system has a number of safety features as well.
Well, of course, the training of the surgeon is very important. Like, one of the main thing that has to be there all the time is that you see your two instruments, okay? You see
Right.
your finger works all the time in the camera. You can control the camera and also your instruments and the positioning as well.
Okay.
So that makes it very precise. You know, when you do robotic surgery, you don't feel the organs, you don't have the touch sensation, you don't have the tactile sensation. It's called haptics. So you know it's hard because when you press on it, you know the tissue doesn't fold in or
Right.
it doesn't bend. You don't know, but you're going to learn it in time.
So this is something that needs to be adapted through training.
Yes,
through a
yes.
lot
And
of
in
training
time,
as
by
well.
practice, you're going to learn it. You know what's hard from not. You know what is solid from not. So this is what we do here. We put our fingers in this, okay? And you can see we also have, it's not only the finger works. We
Okay.
also have footworks. Okay, this is the camera, okay? And these are the arms. This one is for the movements of your instruments to put it properly. We have the bipolar and the monopolar, okay? We also have this one to switch the arm of the robot. Okay, this is the camera. This is where we put our fingers so that we can operate.
So with a system like this ongoing, what is the time in which an operating procedure usually occurs?
Usually it's 1.5 hours.
Okay, so just
By
one and a-
average.
by average, 1.5 hours, everything is done, everything is complete, everything's all checked,
Right.
and the patient is off the recovery.
Yes.
Now, could you tell us about some of the cases that you've encountered wherein robotic surgery does have its advantages?
Okay. Well, as a gynecologist, I do a lot of suspension procedures like sacrocolpopexy, attaching the vault to the sacrum, and you have to do a lot of stitching. Definitely stitching minimally invasively is actually very difficult to do. But with the robotic surgery, remember your instruments and your hands are like the same. The instruments are wristed, so it's like doing it open. This is actually very good in reconstructing the uterus. Remember, when we do myomectomies or removal of fibroids, it's not a matter of just removing the fibroid. You have to reconstruct the uterus properly. With robotic surgery, it's very easy to stitch back the uterus properly, so you do not compromise the patient, even if you're doing it minimally invasively.
You mentioned about myomas, you mentioned
Yes.
about fibroids. Would these certain abnormalities or problems be in a woman who, let's say, wants to give birth, but could these threaten her ability to give birth?
Actually, it depends, because if these are like obstructing the tubes, right, or obstructing areas where the sperm and the egg would meet, then of course it's really good to take them out.
Is robotic surgery for everyone? We will talk about it when we return. Keep it here on Med Talk Health Talk, only on CNN Philippines. You're watching Med Talk Health Talk, and I'm Dr. Freddy Gomez. Many in the medical community would describe robotic surgery as the new revolution. It offers a lot of benefits to patients compared to open surgery. We are joined today by Dr. Jennifer Jose, the head of the Robotics, Gynecology, and Urogynecology Pelvic Reconstructive Surgery here at St. Luke's Global City. Now, going back to our discussion, among women with gynecological symptoms
Right.
or conditions, who benefits the most from robotic surgery?
Actually, the most who benefit from this are those from the reproductive age group, those in the premenopausal age group and the menopausal age group, the elderly.
Okay. Now, in terms of limitations, are there any limitations to this type of system, to this type of procedure?
The indication for open surgery and robotic surgery is the same. It will actually depend on the skill of the surgeon. And of course, we also learned some different techniques, like if you can remove the specimen, or let's say the uterus in a minimally invasive manner. We have some techniques to check on that prior to doing the surgery.
Now, another big factor of this is the pain factor, or the comfort of the patient after this. How much less pain is robotic surgery compared to the traditional type?
This is how I see my patients. When I send them home, I give them only one pill to take for 5 days, okay? So if I give it to them, they come and see me after 5 to 6 days. And I ask them, okay, how's the pain? Oh, doctor, I don't have any discomfort. Look, I did not even take the pills. And when I count them, it's actually 5. So, and they drive themselves to see me in the hospital.
Well, I think the pain factor is very applicable to the elderly, where pain is much more sensitive at a certain age. So this type of surgery will definitely minimize, if not alleviate, any sort of pain. Now, one of the advantages also that you mentioned about robotic surgery was how the downtime of the patient, the hospital stay of the patient is greatly shortened. How could this apply to someone?
I'll explain this to you. It's very easy. Usually when you do an open procedure, meaning the patient is cut up, it will take 6 to 8 weeks for full recovery, okay? And because of the inflammation and this discomfort, of course the downtime is really like 6 to 8 weeks. Now, when you do robotic surgery, remember there is very minimal pain, minimal inflammation. Why? Because there is less manipulation. You don't have a big cut, so the fascia, when you stitch them, it's not moving. There is no pain in the abdomen. Can I just tell you, the patient can actually go home the same day or the following day. Like my patients go home the day after surgery, like having a hysterectomy.
So these are very applicable to people who are very active, who are on the go, maybe some executives of companies where an increased downtime would actually cost them more money.
They can go to meetings, yes, definitely. And people can actually travel right away after a week.
A lot of patients might be curious to know on what type of investment or how does this compare with other types of surgeries offered as well.
It's actually ×3 the amount of an open surgery. Of course, we cannot compromise health, right? We have to emphasize on our health, and we have to look at the possible benefits of this for us to really take care of ourselves.
What we should take from this is this type of technology, the newest technology is available now, and I don't think anyone could put a price on the types of benefit that you said.
You're right about that.
Where pain is definitely minimized, plus the stay is shortened.
Hospital stay, and you can do complex conditions in a minimally invasive manner. I mean, that's really something.
When you talk about complex conditions, for those who don't understand that very well, what type of complex conditions are we talking about?
You have like a lot of adhesions, right? Normally that is actually very difficult to do laparoscopically, or you need to do a lot of suturing, especially like, if you have a pathology deep down in the pelvis. It's actually very difficult, even doing incontinence procedures too. But with this tool, the surgeon can do it with ease and without difficulty. Remember, this is three-dimensional, so you can see the small blood vessels and nerves, and you can look at the anatomy very, very well.
I think that alone is already worth the price of the system.
Yes, right.
Now, what are some tips that you could give for the women out there to sort of take care of themselves, be mindful of what their body, to be able to listen to what their body is telling them?
Actually, it's like this. Health is wealth. I think with the technology that we have, not only in the world, but also in our country right now, it's good to have a general checkup yearly. I normally assign patients to choose a particular date or month in the year so they don't forget about their normal gynecologic checkup, like do a pap smear, mammogram, have an ultrasound, and see their doctor every year.
So we'd like to thank you again, Dr. Jennifer Jose, for sharing that knowledge that this technology is available here in the Philippines for the benefit of Filipinos. And that is all. Thank you for watching Med Talk Health Talk on CNN Philippines. I'm Dr. Freddy Gomez. We'll see you next time.